Well, good morning. My name is Dr. Paul Magarelli. I'm owner of Magarelli Fertility Centers in Colorado. And what I'd like to do this morning is explain what we call our Magarelli Fertility Center inquiries. These are free 15-minute question and answer sessions that we could either do through FaceTime or simply through a phone call. The unfortunate part for you is I do get up at 4 o'clock in the morning and they start at 5 a.m. Mountain Standard Time, so we usually schedule 4 or 5 between 5 a.m. and 7 a.m. But this is how it'll go. I'll call you up on the phone, and please, I know you don't like to have voicemail, and I know a lot of people have that do not disturb button on the iPhone, which means it doesn't ring or doesn't make noise. But if you know you have an appointment, which we'll pre-set up, make sure you're available at the time, because I will call a couple of times and text you, but really it's your 15 minutes and I really want you to get the most out of it. And also, if you have a partner that's joining us or joining you in the creation of One Healthy Baby, have them on the phone. We can have a nice conversation. So this is how it'll go. I have a little form here that my team gives me, and it tells me the date, the time, your phone number, your partner's phone number, whether or not you've confirmed the appointment, and whether you're military, LGBT, or single. I'll then ask you how many years you've been trying to achieve a pregnancy, and likely ask you how many years you've been together. And then I'll ask you your key reason for the call. In other words, do you want to just discover what the issues are? Do you want to do IVF? You already know. Or whatever it is that relates to reproductive medicine. Just give us your topic. We'll also ask you about how did you hear about us, whether it's Google or a doctor referral, military doc. We'll have your location, your zip code, your city, your state, your email, your first and last name, your partner's first and last name, how old you are. And I love to know what kind of work you do. It just gives me an idea if there's any toxin exposures. If you're an LGBT couple, I'll ask if who's going to be carrying the egg, who's going to be providing the egg, who's going to be carrying the baby. Heterosexual couple, of course, I'll talk about both of you. Then the egg carrier or the female, will ask about your periods, whether they're regular or irregular, whether or not you've been pregnant and what happened with that pregnancy, miscarriage, live birth, abortion, etc. Who impregnated you, whether it's your current partner or another partner, and whether or not you've had past fertility treatments. This gives me an idea about where you're coming from. So again, my goal is to get to know you as much as I can in a short period of time to make sure that there's a good fit between us. Then I'll ask you about what kind of medications you've used, if you've done fertility, like Clomid, letrozole, gonadotropins, whether you've done IUI, IVF, embryo transfer, whether you have embryos or want embryos. And then I'll talk about your medical history. Have you suffered with PCOS, polycystic ovarian syndrome? Do you have a diagnosis of endometriosis that's been done surgically? You ever had pelvic infections, gonorrhea, chlamydia? Have you any uterine issues like fibroids, polyps, uterine synechia, or scar tissue, Asherman's? Are there any tubal issues? Did you lose a tube from an ectopic or from an appendicitis rupture? Have you had your tubes tied? Of course, that's going to be important. Your past infertility testing. Have you done a hysterosalpingogram? What were the results? Was it just a normal uterus, no tubes, etc.? Have you had your eggs evaluated? AMH, FSH, OAR. These are initials, but usually you'll know what those mean. They basically tell me about your eggs. Then I'll ask you about any surgeries, dental, if you had your tonsils out, gallbladder, bariatric surgery like a sleeve. Hysteroscopy, have you had that done in the past? Was it normal or abnormal? Hysterectomy. Laparoscopy, was it abnormal or normal? Did you have a laparoscopy for your ectopic? Did you get a D&C for some reason? How many abortions have you had? Have you had C-sections? How many? Did you have a retained placenta or complications from birth? Any orthopedic surgeries or eye surgeries? Then we'll talk about medications. Are you on any type of medications? Prenatal vitamins, folate, etc. Are you on thyroid medicine, antidepressants, anti-anxieties? And then finally I'll ask you, do you have any sisters with children? Then we'll jump over, in this case, to the male. your male partner fathered any pregnancies with you or with another person? Are there any children born? Has he had a semen analysis done? What were the results? Does he have sperm that's frozen? Has he had a vasectomy? Medical history, hypertension, diabetes, erectile dysfunction, past infertility treatment in the form of IUI, ICSI. Has he taken testosterone in the past? Surgical history, has he had a vasectomy? Has he had a reversal? Has he had a tease that to get extracted the sperm? Do we have any frozen sperm available? Has he had a hernia repair, especially as a child, in the inguinal hernia? Varicocele repair of the vessels in the testicles, orthopedic surgery, eye surgery. Does he take any medicines, multivitamins? Is he on testosterone? Just remember that will cause the man to stop making sperm. Antidepressants, anti-hypertensives, anti-diabetes, lipid control. And finally, does he have any brothers with children, biologic brothers? And then finally, lifestyle. A healthy body is a fertile body. Do either of you smoke, vape, marijuana? They all destroy the reproductive potential, especially the male's use of these drugs or lifestyle choices may actually increase your chance for miscarriages. Do you drink? How much do you drink? And on the female, how much caffeine do you drink? And on the male, are you using testosterone? And then finally, that's when I open it up for questions. And we listen and I ask, and then if it sounds like we're a fit, the first thing we're going to do is get you signed up to be a new patient. So that's it in a nutshell. My goal is to get as much information, make your visits as powerful as possible. We're all busy, you're busy. We want to make sure that we ask the right questions and that you're prepared to answer those questions. So I hope you review this short video so that you get a sense of what we're trying to do, and I look forward to meeting you. This is Dr. Paul Magarelli, Magarelli Fertility Centers. Remember, a healthy body is a fertile body. Have a wonderful day.